Aloha, everyone. I hope you are making the most of this day, and I hope you are doing something today to benefit someone else. Welcome to Dr. P's Facets of Life series. This is pod number 19. Today's topic is brain health and self-care. Because we are living longer, because retirement for many is being redefined, because healthcare costs continue to rise, taking a bigger bite financially, of course, and because as we age there is a greater risk of having Alzheimer's disease or other forms of dementia, it is extremely important that we become informed about brain health and how our overall health affects the brain. Let's try to better understand the brain. We used to think the brain was hardwired and did not change, except to eventually deteriorate. We now know that this is not the case. The brain does change. We call that process neurogenesis. That means growing new brain cells. It primarily takes place in the hippocampus, which is the memory and mood center of the brain. Some things that promote new cell growth or neurogenesis are learning, exercise, stress reduction, good sleep, and mastication. That's the act of chewing. Don't ask. Some things that decrease neurogenesis are stress, sleeplessness, and soft diet. In addition, newer research has shown that impaired hearing can also decrease new cell growth and contribute to cognitive decline. Mental activity, especially learning new things, triggers the growth of new cells. I believe that high-level problem solving, the kind you do infrequently, will also increase new cell growth. Now keep in mind that learning in the later stages of life might take a little longer, but we can learn and retain new stuff well into our golden years. One of the most talked about and worrisome issues seems to be about memory loss. Normal memory loss is when we forget something, but then we remember it a few seconds or even a few minutes later. The opposite of this would be forgetting and then not being able to remember at all. This might be cause for concern, especially if this affects our activities of daily living or when we don't recognize problems as being problems at all. In that case, our judgment has become impaired. As an aside, let me say a few things about dementia and Alzheimer's. About 2/3 of dementia cases are actually Alzheimer's disease, age being the major risk factor. There is currently no cure for any of the forms of dementia. So what can we do? There are some memory loss problems that are treatable, such as, but not limited to, depression, vitamin deficiency, drug interactions, sleeplessness, chronic stress, and even a urinary tract infection. All of these problems can be assessed and treated by a primary care physician and/or a mental health professional. Typically, many of these things begin to show after the age of 70 for many of us. They can be based on genetic predisposition, lifestyle, and health issues. So what can we do to slow or stop the deterioration of cognitive function? Allow me to suggest some reasonable options. Stress reduction. In past pods, I've talked about understanding stress and the importance of reducing stress in your life. Just as a refresher, chronic stress promotes systemic inflammation and changes our chemistry. Both things can contribute to cell destruction. Physical activity and exercise. This topic was also discussed in a previous pod. Exercise increases oxygenation in the brain and creates positive chemical changes as well. Keep in mind that the brain uses 20 to 25% of our oxygen. Eating and nutrition, another topic covered in a previous pod. Remember this little saying, what's good for the heart is good for the brain? Yielding blood flow. Social interaction. People who are regularly engaged socially, such as volunteers, members of social clubs, etc., tend to live 3 to 5 years longer and have a better quality of life than others. Control in one's life is key. Meaning and purpose is key. Isolation is not good. And finally, lifestyle choices. You've heard me say that everything in life is a choice when it comes to our behavior. Remember that when you choose a behavior, you choose a consequence. We can choose to be sedentary or active. We can choose to eat sensibly or recklessly. We can choose to engage in a lifestyle that increases our odds of maintaining a healthy brain. Now, speaking of lifestyle choices and healthy brains, let's look at mental activity. Every day we need to participate in some form of stimulating mental activity, such as, but not limited to, activities should be challenging, enjoyable, and novel or new whenever possible. Learn something new. That is what promotes the growth of new brain cells, but not much so with familiar and repetitive activities. When you're familiar with something like crossword puzzles and other things, and they come relatively easy, then you're not really challenging your brain to stretch itself. And finally, learn a language, a musical instrument, new vocabulary words, a new dance, or any dance if you don't dance now. Learn a new game, learn to paint. The list is endless. My favorite new thing is to use your non-dominant hand at least 1 hour a day, working up to 1 day a week. Finally, let me say that choice is our greatest personal power. So please choose wisely and increase your odds of staying healthier longer. Remember, what is good for the heart is good for the brain, and vice versa. Be safe, be smart, and be grateful. This is Dr. P saying aloha.